We are very excited that we were able to take part in the 100,000 Genome Project as part of the NCRI subgroup for CLL and also as part of the Genomics England Clinical Interpretation Partnership Consortium. It's a long name for CLL. So we've now recruited almost 500 patients from clinical trials in the UK. They've all undergone whole genome sequencing. This was a long process, but we have got some results now, and clearly what they indicate so far is that we can use whole genome sequencing as a single test modality to really very comprehensively characterize all the different predictive genomic markers that we have in CLL, and that just makes, from a practical perspective, it makes life in the lab so much easier because we only have one technology. Secondly, what we also find when you're thinking about precision diagnostics, single cell testing will help a lot in identifying maybe 75% of patients in a particular risk group. But if you want to increase this to 95%, then maybe you need a much more comprehensive picture and global picture of the entire genome. And this is certainly what our data indicates so far. So we're very excited that this might be another option for precision diagnostics, and I personally think it will be the future, but we need to analyze a lot more data as well.